To go over a little bit today about a condition called Flexor Hallucis Tenosynovitis. It's kind of a big word. Basically, it's for those that have pain underneath the big toe joint and kind of around the backside of the foot. Many of my patients, before they come in to be seen for this, they've had pain and symptoms for 2 to 3 months. It tends to be people that are more athletic. It tends to hurt when they're doing lunges and kind of walking around, bending their big toe. And then they may have tried different types of treatments, such as inserts or other types of treatments to help it. And it impacts their life because every time they walk, they're going to have pain, usually in the back of the ankle or underneath the big toe joint. And that's why they want treatment. So let me explain a little bit about the anatomy. The flexor hallucis longus is the tendon that pulls down the big toe, and it starts as a muscle in the back of the leg, and then it goes down through the area of this bone in the back here called the talus, and then underneath it pulls down the big toe joint. And patients that are on their toes a lot, let's say they do jump rope or they do other types of activities, ballet, this can get impinged. There's a number of areas that it can get kind of caught up and impinged. One of those is right back behind the ankle. The other one, where I typically see it though, is right at the base of the big toe joint. So kind of right here at the big toe joint. Now there are other muscles and tendons in that area. We call it Tom, Dick, and Harry. So it's the tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So the hallucis is the one we're talking about, is right here. This one goes down and pulls down the big toe. The digitorum pulls down all the digits, and the tibialis posterior inserts right here into that area of the foot. So these muscles, as they come down, you can see this one on the outside, it comes down and it pulls down that big toe. Now, why does this become a problem? Well, if you look here, the muscle kind of comes down and goes underneath here, and it pulls down the big toe joint. And my patients, they tend to have pain right here. So right where this is where the toe would bend up. So when the toe bends up, you can bend the toe up, it hurts. And if I push deep inside of here, it can be a little bit mistaken for the plantar fascia. So if someone has plantar fasciitis, it can have similar symptoms. But this tendon can be a little impinged in that area. This is where I'm seeing it a lot of times, and sometimes it's behind the ankle. How do we treat this? Well, first, we have to do a diagnostic exam. I like to do usually an X-ray to start to see if there's maybe a big bone spur in the back of that talus, occasionally an MRI, but mostly in my hands, I'll look at it with an ultrasound. With an ultrasound, I can look at a tendon. A tendon should look like celery on an ultrasound. And if there's areas of black, which shows swelling, or it just doesn't look very normal, it could be injured. So that tendon can be injured, can be impinged. So an ultrasound really is the diagnostic exam that I do besides the X-ray to see what's going on in there. And how do you treat it? Well, I have this treatment sheet that I put together that will explain it a little bit. There are certain treatments that are most effective, and then there's others that are least effective. And my patients, before they come and see me, they usually try the stuff underneath the yellow line, so the yellow line or below. There are categories of treatments. There are certain treatments that reduce the pain. There's others that reduce the tightness, and I'll explain about that in a little bit. And there are others that reduce the stress going through the foot. So before people come in, they may try anti-inflammatories. They might try some stretching, over-the-counter arch supports or heel lifts, icing or contrast baths, strapping of the foot. So these are all good things. I don't find that these topical creams work all that well. When you come in for the first visit, usually I'm getting an X-ray. I'm going to see you. I'm going to have you start with an anti-inflammatory. My favorite one these days is called meloxicam. The only reason I like it is because it's once a day dosing. But whatever you're going to do, I would do twice a day, and then I would do it with icing or a contrast bath. So icing, you would ice for 10 minutes twice a day on that area. Sometimes with the tendons, if the tendon is bound down, sometimes heat is better. And then I would also try a contrast bath. If you haven't tried that, what a contrast bath is, it's 5 minutes in ice water, 5 minutes in hot water, and then 5 minutes in ice water again. And that can kind of reduce the swelling throughout the foot. Topicals like CBD creams or biofreeze, you can try those. If that doesn't work, I would try that for a couple weeks along with some stretching. Most of my patients, they're going to be getting some home therapy. As I showed you before, that muscle in the back of the calf is being affected. So these patients typically have tightness in the back of the calf, or something called equinus, which is where the calf is tight. So you may get a night splint to hold your foot up, and some foam rolling exercises and potentially some stretching exercise at the first visit. And I might give some shoe recommendations, some new shoe recommendations or some UFOS sandal recommendations. That's the first visit. When you come back in 2 weeks, then we get an ultrasound. And if we see an abnormality in the tendon, like the tendon is not as clear as it should be, then I go to the next step, which is usually either a cortisone injection or shockwave. Most of my patients, I'm doing shockwave now for this. I forgot to mention, part of this home therapy is going to be taking, besides the foam roller on the back of the calf, you're going to be doing some type like a lacrosse ball or a golf ball on the bottom of the foot, kind of massaging in there, even with your hand, massaging on that area of the bottom of the big toe joint where it's tight to kind of break up any adhesions. Then at the second visit, I would do a shockwave therapy. And this is something that I do for my patients to break up the injury in the tightness there, and it helps increase blood flow to the area of the bottom in that area. I find the shockwave works best. And then after shockwave, I do usually 3 to 6 sessions of shockwave. Then after that, I send my patients to physical therapy, and then really depend on the foot mechanics of your foot. If you have a really high arched foot or a really low arched foot, then we would do a custom orthotic. So to learn a little bit more about shockwave, it's used to break up the tissue in that area. Okay. I also put all this together in a treatment sheet. So I'm going to show you this treatment sheet right now on how I do this. So this is a treatment sheet that I use for all of my patients. What this does is it kind of goes over the different types of treatment options. So when my patients come in, I'll fill this out. So imaging, usually X-ray the first visit. Second visit would be an ultrasound. If it's not getting better, then I would do an MRI. To repair and heal the tissue, I find that the shockwave works best. If there's an area of swelling around that tendon, I might do an amnio injection, or I may even do a cortisone injection. It depends. This is the anti-inflammatories. We talked about the icing and contrast baths. And then to reduce the tightness would be the foam rolling or the roller ball, the physical therapy, stretching splint, which is called a night splint sometimes, towel stretch. So this is a 3-minute stretch in the morning. And then different shoe recommendations. I tend to do more of like a supportive shoe. Unless you have a very wide foot, sometimes if a wide foot, I'll do an anatomic toe box. Sometimes patients do correct toes, which are toe spacers, orthotics, or a brace. And then if it's really bad, a walking boot. My favorite at home is a UFO sandal. I just find that patients feel better in those types of sandals. So that is the information about flexor hallucis longus tenosynovitis or tendonitis. It can happen on the bottom of the big toe, also on the back of the foot.